Hi, what are hip dips? Are they actually bothering you when you're wearing a body fit dress and you really want to figure out how to get these treated? This is Dr. Deepthi Devarkonda, consultant plastic surgeon, Eternelle Aesthetics. Let me explain you today what are hip dips and what are all the ideal modalities to get these things covered. Hip dips are usually seen on the lateral side of the hips, both in men and women. In men, this might enhance the masculinity of their figure, but in women, this might sometimes make them appear or look more masculine rather than feminine. In women, we always see an hourglass figure to be more desirable, a continuous, no depressions hourglass figure. So, this hip dips kind of come on the lateral side of the hip, and this can disrupt the continuity of the hourglass figure. So most of the women don't desire these hip dips and definitely want to get them covered. Why do we get these hips? There's a long bone in our thigh which has to join with the hip or the ilias to make a hip joint. When you make this hip joint, that portion is where there is maximum mobility or movement. So this area, because of active movement, usually does not allow fat deposition over that place. It is usually more enhanced in people who are physically more active or people who walk a lot or run a lot. Suppose in males who have a high activity and also as they have lesser fat deposition in these areas, you will see a more prominent hip dip. But in females, usually we tend to deposit more fat in the hip area. But in some cases who have lesser ability to deposit fat or who are more physically active in terms of walking and running, due to this continuous activity over the head of the trochanter, or we say the tip of the femur bone or the long bone of the thigh, we can't deposit fat in that area, or the fat that's deposited is burnt fast and we start seeing these dips. These are not very likely when it comes to wearing body fitting dresses, because they give a very masculine outfit or outlook to the female body. So how do we get them treated? Because this is an inability to retain fat in this area, the ideal solution is to redeposit fat. Ideally, a fat transfer is done in this area. We take out fat from any of the areas of your body where you have excess deposition, process it outside, and then re-inject it into these areas where the fat is not deposited adequately to give a continuous hourglass figure. The thing about hip dips is that because this is an area with active mobility and a lot of friction, because of which you didn't retain your own original fat. Even though we deposit fat in these areas, there are chances that the retention of the fat will be a little less only. So you can expect 2 to 3 sessions to get a complete result, and also post the fat transfer, it is ideal to be in a less mobile situation. I won't say you should really sit down or take bed rest, but reduce unnecessary activity so that the fat is deposited properly. This probably you have to take care for 3 months for the fat to retain. Normally, in normal scenarios, I have seen that a second session would be good enough to cover a deeper hip dip also. But in case you're very keen on it, you might have to opt for 3 sessions sometimes. Other than that, usually this is a daycare surgery and you wouldn't see a great complications or any kind of pain in this surgery. And it's an office based procedure. From next day on, you're back to your normal routine works. So in case you're planning for a hip dip reduction, go for fat transfer and it will give you a wonderful result. If you find this video helpful, kindly subscribe to this channel, share it to all those who might find this video useful, and also please like our channel. And also please like this video.